I think that's the thing, isn't it? For you to get an IP protection, so you need to completely provide all the details why your product is, or how your product is distinct from the rest. And obviously, once that is there and that gets kind of put in the IPO website or WIPO, and then anyone can access it in a way. So, and then the question is, what is the competitive advantage in terms of, okay, fine, obviously nowadays people can tweak a little bit, and then and then obviously your intellectual property protection goes with which particular market, which particular category or classes and whatever. That's the classes that will come into trademarks, but in terms of IP, it will be the markets. And then so let's say then again, if you're not, that takes a lot of money as well in terms of to get a protection worldwide and so on, a lengthier process. So then obviously it's kind of a trade-off and weighing in. So how soon you need to go and when not to go, or is it just an approach of, okay, take the hit and then just launch it, and then so expect or get the best out of first mover advantage and then take it from there. So I think I think you are you're in the same boat in a way. So but approaching it in the correct way, I would say that's great. Yeah, right. So based on the current velocity of progress from the idea to prototype and so on. So what is your roadmap to launch it?
I think our roadmap to launch it depends on when we get our funding in. We've got everything in place, and with our funding, we can really develop our product forward and get it ready for manufacturing. It's funding has been one of our challenges so far. And as a pre-seed company, we know we're seen as a risk to invest in, which we completely understand. And but what's interesting is that venture capital, when it was created, was designed to provide that early risk-taking capital for bold ideas that traditional banks wouldn't touch. And in practice today, especially in healthcare, the bar is often much higher. Investors usually want to see the product fully developed and commercially viable before committing. And we understand that because as times change, so do the demands and expectations. But for us, that only motivates us to stay focused and prove step by step that we're building something that we can genuinely improve patient care. So that really drives us forward. And hopefully, once we secure our funding, it's going to be a straight road to our destination.
Okay, good. So I wish you get all those required support and help as soon as possible. So I think guiding many of the startups we handle. So this is typically a scenario in the UK, like when you compare Silicon Valley or USA. So many of the investors locally here, they're all either quite happy to invest on asset-based investments. When it comes to technology, the appetite and risk taking is not the same. And then quite often either they ask for too much of equity dilution without providing any additional help, just only funds, and not contributing in any other ways to help the startup to grow faster. That frustrates a lot of founders, in our opinion. So so again, I say there is some improvement compared to like observing the market from the last decade or so in the UK as well. But yeah, definitely still nowhere near what a similar idea would get attraction of and investment easily in Silicon Valley, I would say, for any kind of health tech and digital tech startups. So that's where we are. So let's see if things move. Excellent. Right. Okay. So a little bit more into the user research part. So obviously, as the device, so we are targeting predominantly elderly population. I guess that is your first target audience or segmentation. So user segmentation. So within that, you will have various kind of health conditions with mobility issues, and as well as some kind of dexterity, as well as sort of right hand and left hand dominance. So how did you kind of, without disclosing too much, how did you kind of consider and factor in your design?
Yeah, that's a very good question. So the Primarily, when we started developing the product, it was aimed for rheumatoid arthritis patients,
Mm-hmm.
and it was specifically geared towards them.
Mm-hmm.
But once we did our market research, we began to realize that there's a very large population who struggle with manual dexterity and in turn eye drop usage. And this
Mm-hmm.
includes patients with Parkinson's
Mm-hmm.
and also just any kind of age related frailty.
Mm-hmm.
As we get older, our bodies don't work the same as they used to.
Mm-hmm.
And the way that we approach this is that we expand our search from just rheumatoid arthritis, and we
Mm-hmm.
began taking a more holistic approach to market research.
Mm-hmm.
So we talked to uh, care homes whose mainly age-related frailty and
Mm-hmm.
within care homes. We've
Mm-hmm.
approached eye charities such as Glaucoma UK.
Mm-hmm.
We've understood their kind of user challenges, and these
Mm-hmm.
are not just limited to rheumatoid arthritis. And we
Mm-hmm.
found that although our target market is just mainly the elderly and people with these conditions, anyone
Mm-hmm.
who uses eye drops struggles with eye drops.
Mm-hmm.
Even young users.
Mm-hmm.
So recently, I attended a rheumatoid arthritis support group or focus
Mm-hmm.
group, uh,
Mm-hmm.
which was with clinicians and both patients. And I
Mm-hmm.
found that patients who are not the target demographic, so not elderly as we first expected, but young in their 20s or 30s with
Mm-hmm.
very early stages of disease, they still struggle with eye drops.
Mm-hmm.
So we found that just by speaking to people and
Mm-hmm.
engaging with the community, there's a
Mm-hmm.
very big market for our product.
Mm-hmm. Mm-hmm. Very good. Very good. Excellent. Yeah, so I have one person lined up in the next week or the next couple of weeks. She's focusing on, she has a kind of a bundle of products helping improve the medication adherence. So maybe I'll see whether I can connect with her at some point, and then maybe, yeah. And in terms of grants or funding route, have you looked at any partnership opportunities, like let's say pharma companies producing drug like eye drops, or within the kind of ICB space, who want to kind of spend a small amount of money into kind of improving this medication adherence, and as well as obviously if I think that will well fit into new 10-year NHS plan, uh, from analog to digital, so from treatment to prevention, and from this is the one. So from the hospital to community. So I think this product also well fit into that 10-year plan. So maybe I'm not sure if you already considered. So maybe put a compelling case and approach with some of the ICBs, and then say how this would kind of help in terms of within that community. So by having this preventive drops, whatever, that will prevent X number of GP consultations or hospital admissions or patient comfort deterioration, etc. So maybe you can see whether you can get some money from the local ICBs, their part of money. So that's another way of maybe co-working, co-developing with one local healthcare system. So what are your thoughts?
That's actually something that we haven't considered yet, and we really appreciate you bringing that forward to us. So, yeah, currently we've been going for the bigger grant applications,
Mm,
um, and kind of the national ones
mm,
associated with all the UK. But
mhm,
if we approach our local regional ICBs
mhm,
and we can show the impact it can have on community, I think
mhm,
we'd have a much higher rate of success. That's
mhm.
something we should take forward.
Yeah, yeah. So just so that way, one is you can create a kind of local ambassadors who would be promoting your product. At the same time, once you have their approval in principle, so then at least it makes it easier to engage with and even to trial launch faster in a small set of population, and as well as utilize the existing funds from the budget. Excellent. Right. Okay. So it's been wonderful listening to all three of you. So I'm very, very impressed with the way you are approaching and early on. Yeah, I see kind of no doubt that if you continue with the same amount of passion, focus, and approaching with this kind of continuous learning approach, your venture would be so definitely a successful one. So locally, nationally, internationally, it's got a large potential. So best wishes to you all.
Thank you.
Thank you
So
very
now,
much.
yes, sorry, sorry, Richard. So you were about to say something.
I said thank you. Thank you very much for the kind words.
Pleasure. Yeah. Yeah. So now, if you have any questions for me, or so just
Yeah.
fire away.
Yeah, we would love to ask a few questions and get your insights on your experience, because we know it would be really valuable to us and to the listeners as well. My question is, looking back, what's one insight or piece of advice that would have been game changing for you at the start and would have made a real difference if you had known?
Right. The entrepreneurship is a long journey, right? So when I started transitioning from a clinician to a tech space or an entrepreneur, so I made some mistakes. So thinking that, okay, we can achieve A and B, this kind of milestone, this kind of time frame. But once you are in the trenches, then you understand that there are X number of things that can influence, and always you'll have this kind of moving target as well. So at that particular point when I transitioned, also like one of the mistakes I would say, reflecting back, so I didn't get any specific mentorship or advice. Okay, so probably at this stage now, I would say probably I should have done that. I would strongly advise. As we speak, we are working with another bright digital health idea, and then she's a doctor as well. We are kind of developing this equity basis partnership in the project, and then the founder of that project, she came to our office, and then she said, once this MEP is launched, she's going to wind up clinical practice and so on. I told her, please do not do that. Okay, yeah. So yeah, because it takes a lot of effort, and then you still need to have that kind of financial stability at the individual level. At the same time, if you approach someone like, okay, I'm going to purely depend on venture capital money, and then it comes with its own kind of stresses as well. Invest money in you, they expect certain kind of milestones achieved, progress, and so on. That adds that additional pressure. So to balance it out, I would say, I suggest basically, so one is I shifted completely one particular day. Yes, I'm going off, right? So which is not necessarily a great one, in my opinion. So it's always better to have a sort of a slower transition until you are almost definite where you have at least a 12 months or 24 months runway in your business, cash flow, and because otherwise it burns very fast in a way if you're not very sensible. So that would be one thing I would say. So don't make impulsive decisions. So, but at the same time, transition at a gradual pace, and have some mentors early on in your business.
Thank you.
Thank you.
Thank you.
My question would be, so with a background in general surgery, which is a very technical and a very time-consuming career, how did you manage to ideate DigiWrite alongside that, balancing the responsibilities of both careers and avoiding burnout in the process?
Yeah, so my transition, so as a surgeon working within the NHS, it's a great organization. I love my work, but at the same time, back in like 10, 15 years ago, the change was very difficult. So it's a bigger organization. It comes with its own pros and cons. At some point, I felt that routine was kind of pulling me down. So I said I can do a little bit more, and that's when my wife, she qualified as a GP, and then I had that kind of stability of income, and then I took some time off, and then went to London School of Economics, enrolled myself into Masters in Health Policy Planning and Financing. So that completely changed my outlook from a clinician to a healthcare, global healthcare. And not only that, being in central London and LSE being a premier institution, so there used to be always a lot of guest lectures, people like Nobel laureates, people who are leading the central banks, and entrepreneurs, financial services legends, and like many political leaders from across the globe will come and deliver lectures. So that kind of slowly kind of opened up my mind and sort of changed my thinking. So then I thought, okay, what are the other ways and means by which you can still create an impact for the society? Obviously, if you look at, we all we are part of society and we do something for the society. That's how we live. That's kind of ecosystem. Then expanding it further. So what are the ways and means by which, not as a clinician having an impact one-to-one to a patient in front of me, where I can make an impact to a larger society and audience population. So that was my outlook. Another thing is coming from India, like always I'm quite keen to see how I can contribute to low and middle income countries' health economies as well. So that always pushes me. And so that way, slowly I thought, okay, what are the best way we can go about achieving that? Then if I looked at, then technology is a very big enabler in that space. So I had some ideas, and I was to develop some digital product back in those days, and we spent nearly a year finding a right technology partner to develop it. So then obviously time is lost and some money is lost, and still we were not getting the quality of output what we wanted to have from that. And with that frustration, then kind of we formed this company, Digitech. So yeah, I met a guy in Manchester who was doing a master's in information systems. He's from same city where I grew up. And then I got back in touch with him and I said, this is what I'm thinking. I got this idea. So then he was quite keen and we both got together and formed the company. Yeah, so I think from there, I think it's been I like the space because every day I'm learning something new. So I don't code that much, but I understand the full kind of technology, interacting with 50 plus engineers across various domains and so on. So playing cross-functional roles within the technology space. So I've been working as some projects I was a business analyst, some projects I was a delivery person and whatever. So like I like that kind of challenge, bit open and still kind of having strong roots in kind of healthcare, that space, and linking it back.
Fantastic. Thank you.
Finally, my question is, if you were in my shoes right now with limited resources, just starting out, what would you focus on first?
So I would say there is nothing that, as I said before, the only thing that we can focus on is our actions and our commitment to what we believe in, right? The results are never guaranteed, but definitely the probability of achieving the results is higher as long as we stick to that work ethic, okay? Having that consistent approach, having the same amount of focus, and developing that attitude even when things are not going well. So because like even though you think that things are not happening, but there is a system or a people are watching you how you are conducting yourself.
Mhm.
So that's what would where that in a way you are building your character. So if you look into this space of growth, so one is obviously personal growth is very important. Having growth mindset is very important. And next thing is having the right people around to kind of who support your vision, and then just self reflection, evaluation at frequent intervals would find like what is that you're doing right, what is that you're not doing right, where you need to be. So that kind of approach, and then coming to kind of actual startup itself in terms of funding, that kind of space. So here people don't invest obviously idea is good, but the investment decisions are more often made based on what the team is composed of, right? When we say team composed of is one thing in terms of what kind of complementing skills and they bring in experience. So not only that, like so evidencing that how strong you feel about your baby or child, you call it this idea. So how, in spite of what kind of challenges you underwent, in spite of that, you still believed, and then you just making progress. And if you kind of showcase that to any investor, so that would kind of impress them. right? So obviously there is no shortage for ideas in the world. Ideas are plenty, right? So the success comes in terms of believing in that idea and then following it up with strong work ethic and continuing in spite of struggles, and then you can manifest yourself. You'll get the right resources in front of you as you progress. Yeah.
Thank you.
Okay, keep doing what you're doing. Anyway, yeah.
Thank you.
Thank you so much.
Pleasure. Yeah. Excellent. So thank you all for joining me today. And it's been such a wonderful morning interacting with such bright minds, focusing on making real change in the real world. And our best wishes to all success.
Thank you so much. Thank you so much.
Thank you.
Thank
It's
you.
been a
Pleasure.
pleasure to be here.